Hello there! Let's talk about something incredibly important in nursing, placing an intravenous or IV line. Think of it as creating a tiny direct motorway into a patient's bloodstream. This little plastic tube is one of the most common and vital procedures you'll perform. It allows us to give patients fluids when they're dehydrated, deliver life-saving medications quickly, provide nutrition, or administer blood transfusions. The ability to establish IV access promptly and efficiently can make a huge difference in a patient's treatment and their overall experience in our care. It truly is a fundamental skill for every nurse. Mastering this skill isn't just about being technically good at it, it's also about building trust with your patient. For many people, the thought of a needle can be quite scary. When you approach the procedure with confidence, calmness, and clear communication, you help put them at ease. A successful IV insertion on the first try not only saves time and resources, but also minimizes discomfort and anxiety for the person you are caring for. It shows them they are in safe, capable hands, which is a massive part of providing excellent and compassionate nursing care. This guide is here to help you feel more confident every step of the way. We'll break down the entire process, from gathering your supplies to watching for potential problems. It doesn't matter if you're a student nurse just starting out or an experienced professional looking for a quick refresher. The goal is to make you feel prepared and proficient. Remember, like any skill, practice makes perfect. Every attempt is a learning opportunity that makes you a better, more skilled practitioner for the patients who depend on you. So let's get started on this journey to mastering the art and science of IV insertion. It's a procedure that requires knowledge, precision, and a gentle touch. By understanding the why behind what we do, the what we need to do it with, and the how to do it well, you'll be well on your way. You are providing a critical lifeline for your patient, ensuring they get the treatment they need, exactly when they need it. This is a responsibility, but it's also a privilege. Before you even think about approaching the patient, the first step is to get all your ducks in a row. Being prepared is half the battle won. You'll need to gather all your equipment so that everything is within easy reach. This prevents you from having to scramble for supplies midway through the procedure. Your IV insertion tray or trolley should be clean and organized. Start by grabbing a selection of IV catheters in different sizes. It's always good to have a couple of options. You'll also need a tourniquet, which helps make the veins pop up and easier to see. Next on your shopping list are the cleaning supplies. You will need antiseptic wipes, usually containing chlorhexidine or alcohol, to thoroughly clean the patient's skin before insertion. This is a crucial step to prevent infections. Don't forget to grab some sterile gauze pads. 2x2s are perfect, and a transparent dressing, like a tegaderm, to secure the IV once it's in place. You will also need a roll of medical tape to provide extra security for the tubing. And of course, you must always have gloves. Non-sterile is fine for the insertion, but they are non-negotiable for your safety and the patient's. Now for the wet stuff. You'll need a saline flush, which is a pre-filled syringe of sterile saline solution. This is used to check if the IV is correctly placed in the vein and to keep the line open. You will also need the IV tubing, also known as the administration set, which will connect the IV bag to the catheter in the patient's arm. Make sure you prime the tubing by running fluid through it to get all the air out before you connect it to the patient. An IV pole will be needed to hang the bag of fluids. Finally, think about safety and disposal. A sharps container must be right there with you, within arm's reach, so you can safely dispose of the needle immediately after you remove it from the catheter. This is incredibly important for preventing needle stick injuries. Having all these items ready before you even introduce yourself to the patient shows professionalism and makes the entire process smoother and safer for everyone involved. It turns a potentially stressful moment into a calm, controlled procedure. Alright, you've got your gear and you're ready to go. First things first, wash your hands and introduce yourself to the patient. Explain what you're about to do in simple terms. Ask them which arm they prefer, avoiding the side if they've had a mastectomy or have a fistula. Put on your gloves. Now it's time to find that perfect vein. Apply the tourniquet about 4 to 6 inches above your chosen site. Ask the patient to open and close their fist a few times. Look for a vein that feels bouncy, straight, and soft. Avoid areas near joints or any veins that feel hard or bumpy. Once you've picked your spot, it's time to clean the area. Using your antiseptic wipe, clean the skin thoroughly using a firm circular motion, moving from the inside out. Let the area air dry completely. Don't blow on it or wave your hand over it, as this can introduce germs. While it's drying, uncap your IV catheter and give it a quick inspection. Make sure the needle is straight and the catheter moves smoothly. Hold the patient's arm and use your non-dominant thumb to pull the skin taut just below the insertion site. This helps to anchor the vein and stop it from rolling away. Now, for the insertion. Hold the catheter with your dominant hand, bevel the slanted tip of the needle facing up. Approach the vein at a low angle, usually between 15 and 30 degrees. In one smooth, steady motion, pierce the skin and then the vein wall. You're looking for a flashback of blood in the catheter's chamber. That's your sign that you're in. Once you see the flash, lower the angle of the catheter so it's almost parallel to the skin. Advance the catheter just a tiny bit further, about 1/4 inch, to ensure the plastic cannula itself is inside the vein. Here comes the crucial part. While holding the needle still, use your index finger to gently push the plastic catheter hub all the way into the vein. Once the catheter is fully advanced, release the tourniquet. Press down gently on the skin just above the tip of the catheter to stop any blood from leaking out, and then activate the safety mechanism to retract or cover the needle. Immediately dispose of the needle in the sharps container. Attach your primed IV tubing or saline flush. Secure the catheter with your transparent dressing and tape the tubing in a loop for extra security. You've done it! Placing the IV is a big part of the job, but our work doesn't end there. Throughout the entire process, your patient's comfort and safety are the top priority. Talk to your patient, let them know what's happening, and encourage them to take slow, deep breaths. If they are particularly anxious or have a fear of needles, a bit of distraction can work wonders. Ask them about their day, their family, or a favorite hobby. A calm and reassuring presence can make a world of difference and significantly reduce their pain perception and anxiety. Once the IV is secured, it's time to check your work. Slowly flush the line with the saline solution. As you do this, ask the patient if they feel any pain or discomfort at the site. Watch the area closely. You're looking for any signs of swelling, puffiness, or redness, which could indicate a problem. The fluid should flow in easily with minimal resistance. If you see swelling or the patient reports pain, the IV is likely not in the vein correctly. This is called infiltration, and you'll need to stop, remove the catheter, and try again in a new location. Common problems can and do happen, so it's important to know what to look for. Infiltration, as we just mentioned, is when the fluid leaks into the surrounding tissue. Phlebitis is inflammation of the vein, which can cause pain, redness, and warmth along the vein. Sometimes a small blood clot can form, which is called thrombosis. Regularly check the IV site throughout your shift. Look at the site, touch the skin around it to check for temperature changes, and always ask the patient how it's feeling. Finally, remember that documentation is key. After you've successfully placed and flushed the IV, document the date, time, the size of the catheter you used, and the location of the insertion. Also, note how the patient tolerated the procedure. Proper monitoring and documentation ensure continuity of care and help your colleagues quickly identify any issues that might arise later. By keeping the patient at the center of everything you do, from preparation to follow-up, you'll not only master the skill, but also provide the safest, most compassionate care possible. Well done!